Hi everyone! For today's topic, we will be discussing about the Papanicolaou staining technique. But before that, I want you to know that Papanicolaou stain or the Pap staining method is under the big umbrella of Diagnostic Cytology. Under Diagnostic Cytology, it also belongs under Exfoliative Cytology. So let's differentiate first what diagnostic cytology and exfoliative cytology means. Diagnostic cytology class simply means microscopic examination of cells from different body sites for diagnostic purposes. Diagnostic cytology includes exfoliative, abrasive, and aspirational. But for today, let's focus on exfoliative cytology. It deals with the microscopic study of cells that have been desquamated from epithelial surfaces. Exfoliated cells may be found in smears that have spontaneously been shed or physically removed from epithelial and mucous membranes such as the vagina, buccal mucosa, and from body fluids such as the sputum, urine, pleural, peritoneal or ascitic fluid, the gastric juice, and cerebrospinal fluid. Spontaneous exfoliation is observed in normal cells due to constant growth and replacement with new cells, but are more readily observed also in malignant tumor cells. To date, class, Papanicolaou or Pap smear is considered to be the staining method of choice for exfoliative cytology. The diagnosis of malignancy by microscopic examination of a group of isolated cells has been advocated by Dr. George Nicholas Papanicolaou, who, while examining vaginal secretions from rodents and human subjects in an effort to correlate cellular patterns with the sexual cycle, he had developed a staining method which identified stages in the maturation of exfoliated squamous epithelial cells and in effect was able to formulate a method with which malignant cells could be identified. Pap smear is originally indicated for vaginal smears to detect human uterine and cervical cancers. Pap smear has been applied for evaluation of practically all types of specimen received in cytology laboratories. It is also used in the early detection of cervical and vaginal carcinomas and scrapings from the uterus. The smear technique can also be used to detect cancerous cells of the breast through aspiration of mammary gland tissue, long bronchial brushing, and washing from bronchoscopy or coughed up sputum. From the stomach, those aspirated gastric secretions, and from the renal system, the urine sediment. It is also indicated, class, that Pap smear is a routine screening technique and for the workup of disorders of reproductive function. This Pap smear technique is the most widely used cancer screening tool and is a cytologic examination of desquamated epithelial tissue to differentiate normal from anaplastic cells. There are actually two general methods, the traditional slide method and a newer liquid method or what we call the cytocolor PAPS modified. In the traditional method, one prepares the smears by scraping or aspirating cells from the tissue to be examined, that is, from the transformation zone of the cervix or the T-zone, transformation zone of the cervix, and fixem them on a glass slide using ether and 95% ethyl alcohol solution. Exfoliated cells degenerate rapidly. Therefore, smears should be prepared promptly and fixed immediately. If there is any delay, the specimen should be fixed in 95% alcohol and refrigerated until smears can be prepared. Specimen requiring centrifugations are preserved by adding an equal volume of 50% alcohol. Centrifugation is at 2000 RPM for 30 minutes. Slides are then dried, stained, and examined under a microscope by a pathologist or cytotechnologist. In the newer liquid path method or the cytocolor modified PAPS technique, the tissue scrapings are placed in liquid to remove mucus and debris which can interfere with the view through the microscope. But before that class, I want you to meet the different equipments, materials, instruments used in the procedure pap smear. Among all the equipments here, class, I want you to know the speculum and the air spatula. So the speculum, class, that is that grayish thing that you can see on the screen. That one is inserted into the woman's vagina. You can do some manipulations with this and open the vagina to reach the cervical area. While the air spatula or the brush is used to scrape the T-zone or the transformation zone of the cervix. This is found in between the endocervix and the ectocervix. That's where usually cancer cells first emerge if there is really an abnormality in the girl's reproductive system. So the doctor, the gynecologist, or the cytotechnologist will do a 300-degree scraping in the cervical area to collect all the cells for examination. This procedure can be performed on mothers that already have given a child and also all sexually active females. So this is how it's done, class. So you insert the speculum. Yes, this procedure is uncomfortable and this can also hurt. Once the target specimen has been collected, you can now make your own smear preparation, which is of course made from a fresh material. Spread it evenly on a clean slide and make sure to properly label your slide with the patient's name, the patient's age, date of birth, date of collection, and from what type of specimen does this come from. So if it comes from a cervical scraping, then you place their cervical scrapings or urine or pleural fluid, peritoneal, sputum, whatever type of specimen that may be, class. So just place it there on the frosted end of the slide for labeling. Make sure to always label your slides for proper identification. Since we're done with the proper location on where the specimen must be collected, the types of specimen to be collected for pap smear, we also know already the different equipments, materials, instruments used to collect the target specimen. Let's know the composition of the pap smear staining procedure. There are actually two fixatives that we can use alternatively if one is not available. So we have ether alcohol or the PAPS fixative and the 95% ethanol, which is the one commonly used. But this PAPS fixative class or the ether alcohol, this is considered to be the best fixative for pap smear. But the reason why it is not already commonly used nowadays, class, is because of its volatile character. The PAPS fixative class is made up of equal parts of 95% ethanol and ether. Aside from getting acquainted with the different fixatives used for pap smear, we should also know the different reagents used to stain our slides for pap staining. The primary stain used, class, is hematoxylin. In this case, from the book, we are using Harris hematoxylin. This stains the nucleus blue or dark purple to black. The first counter stain used is orange green 6, so OG6. This is used to color the cytoplasm of mature superficial cells and keratinized cells. This will stain the cytoplasm of mature cells with a different intensity of orange. The second counterstain use class for pap smear is Eosin Azure 36 or EA50 or EA65. This will color the cytoplasm of immature cells, so it gives it an olive green with a hint of brown or red. This Eosin Azure counterstain class is made up of a polychrome mixture. So that's azure or Eosin Y and Bismarck brown and light green SF. Eosin Y class gives pink color to the following: while for light green SF, it is another component of the polychrome mixture of Eosin Azure class. It stains blue to cytoplasm of cells like the one written on the screen. And lastly, for Bismarck brown Y, it stabilizes the staining solution of Eosin Azure. But before we proceed, I have another information. Eosin Azure is the counterstain used to stain body fluids. So that's EA65 or Eosin Azure 65. If ever orange green 6 is not found or is not available, the alternative counterstains used may be 80% to propanol. While for Eosin Azure, the alternative solution that we can use is 2-propanol. For the procedure for the Papanicolaou smear, first the smear is placed in a fixative immediately while still wet to prevent drying artifacts. The smear must be kept in fixative for at least 1 hour, and then after an hour, hydrate in 95% alcohol for 2 minutes, then 70% alcohol for 2 minutes. After rehydration, you can rinse it with tap water for 1 minute. After rinsing in tap water, you now stain the nucleus with Harris hematoxylin for 5 minutes. So you immerse your slide into Harris hematoxylin. Rinse again gently in tap water to prevent cells from being washed off for 2 minutes. Differentiate carefully the nuclear staining in acid alcohol for approximately 10 seconds or at least until the sections become until faint pink. Bluing agent used can be ammonia water, Scott's tap water substitute, or lithium carbonate. And rinse it again in distilled water for another 2 minutes. Dehydrating it with 70% alcohol for another 2 minutes. Dehydrate once again in 95% alcohol for 2 minutes and another 95% alcohol for 2 minutes. Next is staining it with orange green 6 for 2 minutes and then rinsing it in 2 baths of 95% alcohol for another 2 minutes each. So 95% alcohol and then another 95% alcohol. Staining it with Eosin Azure 36 or 50 or 65 for 3 minutes. Rinsing it again in 95% alcohol for another minute. And rinse it for the last time in saline, at least 4 changes for clearing. This procedure class is the standard or the traditional Papanicolaou staining method. But if we do the modified PAP cytocolor method, this gives results in less than 3 minutes, can be used for gynecological samples such as vaginal smears, vaginal fluid, and for non-gynecological samples like gastric lavage, sputum, urine sediment. Here are the steps for the cytocolor modified PAPS technique. First, dipping your slide into distilled water for at least 10 times. And then dipping it for 1 minute in hematoxylin. Rinse in tap water for 5 seconds. And the first counter stain used in cytocolor class is 2-propanol. So at least 2 dips. So 2 dips. And then the polychromic solution for 1 minute. And another 5 dips for 80% 2-propanol. Next is 2-propanol again for 10 dips. And for clearing, lastly, is xylene, another 10 dips. And now you're ready to mount your slides for reading. You may want to ask me, class, why there are different techniques in doing the PAP staining method. It also depends upon the manufacturer, class. So whatever is written in the package insert of your staining reagent, you have to follow it. So it doesn't necessarily be like what I am teaching here right now because it really depends upon the manufacturer. But somehow the principle, its usage, and its importance is still totally the same. Once you're done staining, you're now ready to read it under the microscope. So what are the different cells that you can identify under the microscope with the use of Pap smear or Pap staining technique? Here in the picture, class, are some of the normal cells that can be found in the cervix of a woman. So number 1, we have superficial cells or the mature superficial cells. Kindly write this down. Mature superficial cells, class, are polygonal squamous cells measuring 45 to 50 micra in diameter and are usually identified by the presence of pale pink staining cytoplasm and dark pycnotic nucleus. True acidophilia is characteristic of superficial vaginal cells under estrogen influence. But this is not, however, a reliable index of maturation, okay? So when you see predominant mature superficial cells, that means that this woman has an increase in estrogen. Pseudoacidophilia may be observed due to the drying of smears, especially before fixation, prolapse and drying of vaginal epithelium, infection, and chemicals. So there can be false acidophilia if those things happen. Next is intermediate cells. So these are medium-sized polyhedral or elongated cells with basophilic vacuolated cytoplasm. So this is also seen in patients with increased progesterone. Instances where progesterone is increased, class, is during the follicular phase of the menstrual cycle as well as the second and third trimester of pregnancy. So those are the usual times wherein progesterone is increased and intermediate cells can be detected. Next is parabasal cells. So these are round to oval cells with small dense basophilic cytoplasm and a total cell diameter of 15 to 30 micra. They are smaller than intermediate cells and have a larger vesicular nucleus. They are normally found from 2 weeks of age to puberty. So you can see these cells in patients that are in puberty, after childbirth, women with abortions or miscarriages, and after menopause. So this has a fried egg appearance under the microscope. When pathologists and cytotechnologists read slides like this under the microscope. They also take note on the normal maturation index, the PIS, or parabasal intermediate superficial cell ratio. So kindly write this down. The normal PIS, or parabasal intermediate and superficial cells, is 0, 70, 30. So this must be the normal ratio in order for the pathologist to know that the patient is normal or there are no underlying medical condition going on. But just a reminder, class, that these cells are normal cells that are found in the cervix. So this will just give the pathologist or the doctor that this woman might be on its estrogen phase or its puberty or with abortions or after menopause. So those things that gives information to. There are also other cells, class, that may be found in the cervico-vaginal smears. This includes endometrial cells, which are small cells. They're slightly cylindrical with less basophilic cytoplasm, occurring in tightly packed groups of 3 or more. They're found during and around 1 to 10 days after your menstruation and are shed in response to ovarian hormones. A smear taken during menstruation will contain endometrial cells and numerous erythrocytes and leukocytes, frequently rendering the smear unsatisfactory for a reliable assessment. So this is how an endometrial cell look like. There is also the endocervical glandular cells. They occur in large groups or small sheets. The cytoplasm of endocervical glandular cells are usually stained pale blue or gray and is finely vacuolated, often with indistinct cell borders and nuclei with finely granular chromatin. They may present a honeycomb appearance when viewed on end. Next, navicular cells are also cells found in the cervicovaginal smears. So these cells are boat-shaped intermediate cells with strong tendency to fold or curl on edges. Their presence suggests a combined estrogen-progesterone effect. They are found in the latter half of the menstrual cycle, during pregnancy, and also menopause. Next, we also have pregnancy cells. So these are round, oval, or boat-shaped cells with translucent basophilic cytoplasm observed greatest at the center of the cell due to its glycogen accumulation, pushing the nucleus to the side or towards the cell membrane. This appearance is characteristic due to a deeper blue stain of the cytoplasm at the periphery. The advantages in using the Papanicolaou method, both the standard and the modified Papanicolaou staining procedure, is that the transparent blue staining of cytoplasm, class, is obtained due to the action of high alcoholic content of the cytoplasmic counterstain, allowing overlapping cells to be seen and still be identified. Excellent nuclear detail is produced. The color range can be predicted and of great value in identification and classification of cells, producing a good differential coloring of basophilic and acidophilic cells. It is valuable in comparing cellular appearances in smears with their counterpart in similarly stained sections. Let's now proceed to the proper reporting for gynecologic cytology. Actually, we have 2 types of reporting systems, class: the class system and the Bethesda system. The class system, class, is divided into 5 classes. We have class 1 for negative or normal. Class 2 is atypical, so not sure, is not the same as those of the normal cells, so atypical. Class 3 is cytological picture, suggestive, but not conclusive for malignancy. Class 4 is strongly suggestive of malignancy, and Class 5 is conclusive of malignancy. It is the pathologist class in the laboratory that gives the proper classification of the reporting. So whatever is seen under the microscope, they interpret that and they write the class or the grading. Since class system is no longer used class and obsolete, the Bethesda system is then introduced. So in the screen, you can see there that the description, the Bethesda system, grading system, and the class system. So when the pathologist sees that all the cells in the slide are normal, then they grade that as negative for IEL or negative for intraepithelial lesion. The equivalent class system class that belongs to class 1. For atypical, so they grade that as atypical squamous cell of undetermined significance, or they write ASCOS. That's under the Bethesda system, which is the accepted system of reporting right now. And in the class system, the equivalent to that is class 2. When the pathologist sees an infection that is suggestive of human papilloma virus infection, then they grade that as low-grade squamous intraepithelial lesion, or LSIL. The equivalent to that in the class system is still class 2. When the pathologist detects mild dysplasia or mild abnormal development or growth of the cells in the slide, then they still grade that as LSIL, or low-grade squamous intraepithelial lesion, and equivalent in the class system is 2. If moderate dysplasia, that's already high-grade squamous intraepithelial lesion, or HSIL. The equivalent to that in the class system is class 3. For severe dysplasia or abnormal growth of the cells, that's still HSIL. The equivalent class system is 3. And if there is already carcinoma on the location or carcinoma in situ, so that's HSIL, and the equivalent grading is class 4. Let's discuss about the factors that may affect the results after staining and during the reading by the pathologist. Number 1, smears that dry before fixative is applied cannot be properly interpreted. Do not lubricate the speculum because the lubrication or the lubricant distorts the cells. Using of formalin as a fixative invalidates the results. Remember that the fixative used for pap smear procedure is 95% alcohol, or the PAPS fixative. That's equal parts of 95% ethyl alcohol and ether. Next is water or lubricant on the specimen can distort the cells. Also, always identify the slides before preparing the smears. There should be proper labeling and identification. Attach a paper clip to the identified end of the slide before preparing the smear. Paper clip prevents the slide from sticking together in the fixative. Smears should be placed into the fixative container immediately after preparations. Place each smear in fixative by a single uninterrupted motion to avoid rippling of smeared material. Also, class, avoid striking the bottom of the fixing container forcefully to prevent dislodging the material from the slide. Take note, class, to avoid fixation delay, have the fixative bottle open before preparing the smears. For proper fixation, if spray fixative is used, the slide should be kept in a distance from the slide approximately, how far is it? 12 inches away. Medications such as tetracycline or digitalis preparations can affect the look of squamous epithelium. Blood, mucus, or pus on the slide makes accurate specimen interpretation difficult. Cells that are damaged from excessive manipulation during collection may be interpreted as atypical. For your information, the cell on the screen class is what we call a koilocyte. So this is a squamous epithelial cell that has undergone a lot of abnormal changes due to structural modification by the human papilloma virus. So this cell class has a wrinkled prune nucleus with a perinuclear halo. That is it for our discussion regarding Papanicolaou smear. I hope you've learned something new from me today. Don't forget to like and subscribe this video and my channel. Thank you so much for listening and God bless us all. See you soon!